Since the year 2000, collective global efforts have saved more than 74 million lives from tuberculosis. However, this progress has been eroded by several factors, including the COVID-19 pandemic.
We set a target to reach 40 million people with TB with treatment, and we reached 34 million. We set a target to reach 30 million people with preventive treatment, but only reached half that many.
The World Health Organization has since declared a funding crisis in the global fight against tuberculosis.
The out-of-pocket costs associated with treating TB expose them to financial hardship or drive them further into poverty.
Funding for TB services in low and middle-income countries saw a decline from $6.4 billion in 2018 to $5.8 billion in 2022. This signifies a staggering 50% financing gap in implementing the necessary TB programs. In Kenya, 120,000 people are infected with TB annually, and 32,000 die from TB each year.
In 2021, TB killed more than 1 million people.
W.H.O is to this end urgently calling on world leaders to commit to concrete targets for the next 5 years. The proposed targets encompass 4 critical objectives: reaching 90% of people with TB prevention and care, using WHO recommended rapid tests, providing social benefits packages, and licensing a new TB vaccine.
The only licensed TB vaccine was developed more than a century ago. It saves thousands of lives every year by protecting young children, but does not adequately protect adolescents and adults.
Currently, BCG remains the sole licensed vaccine for tuberculosis for over 100 years. Ben Kirera, K24, Nairobi.